All right, so we go with the last part. So I would try to now in this highlight two things mainly. Um, the major innovation of Lyfas LRCB coherence and the orthostatic. So I'll start with orthostatic, which is a very important and interesting part of the whole Lyfas system. So the as we have learned so far that the entire role of the autonomic system and the entire body, therefore, is to maintain a homeostasis. And one of the homeostasis is the orthostatic homeostasis. So if a person is, say, in the supine position or while the person is, let's say, sleeping, now what actually happens is, let's look into this condition. Okay, so when the person is basically sleeping, what happens, or in the sleeping position, what happens is the heart is, the axis of the heart is in parallel with the axis of the ground. The entire body is parallel, so it's in the parallel. So when the heart is pushing the blood in other part of the body, it doesn't have to work to uh, it doesn't have to work harder. It can push blood. The blood can circulate through the entire vascular system. So the heart's overall operation gets reduced. That is the reason whenever somebody is ill, we advise them to take rest, because then heart doesn't have to work harder to supply blood to the other part of the body. Then heart can meet the demand of the immune system. Heart can meet the demand of the repairing system of the body. This is the primary reason why we advise anybody to take rest whenever somebody is ill. You don't advise somebody to take rest when somebody is going through the depression. Remember again this thing. So depression is primarily where the autonomic system is down, sympathetic system is down. So for such kind of cases, you just make them to work harder. But the other cases, somebody has a cardiovascular problem, COVID, somebody has got cancer, any kind of bronchitis, all the other diseases, malaria, we ask them to sleep. The reason why we ask them to sleep is heart has to work less hard to push blood to the part of the body, so then it can meet the requirement of the repair system. Now what happens when we make this person stand? So let's say when you are standing, what is happening is there are two stress that happens over here. Number one, the distance between your brain and the ground increases. Now when the heart has to put the blood to the brain, when heart has to push the blood towards the brain, it always goes against the gravity. So the gravity is basically acting against the heart at this stage. So heart has to work against the gravity, and therefore it is always under stress. So the moment you stand up, there is a low blood pressure in the head, which heart has to immediately compensate and increase the blood flow so that the brain gets enough circulation. And once this circulation is restored, the system goes into homeostasis, which we call the orthostatic or the standing position homeostasis. And how it is done is we have a baroreceptor right here close to the voice box, near the pituitary gland and the carotid artery. So this baroreceptor's job is to measure the blood pressure at the top part, blood pressure at the bottom part, and tries to keep the constant blood pressure. And whenever you stand up, baroreceptor sees that the blood pressure variation, triggers the heart, and heart has to send the increase the blood flow so that the homeostasis is restored. Now, if there is an orthostatic impairment. Orthostatic impairment, in a sense, either baroreceptor is not working, or heart is not capable of supplying enough oxygen to the brain as urgently as it is required. In the case of orthostatic impairment, the first thing that happens is our brain gets affected. The chances of stroke increases, the chances of many brain neurons getting dead increases. So there are damages in the brain. There are damages. There are mainly damages in the brain part if there is an orthostatic impairment. Now, one of the clinical condition is called orthostatic hypotension. Orthostatic hypotension is when you stand up, your brain gets less tension or less blood pressure. Or orthostatic hypotension, again, is a common outcome of diabetic. The other common outcome of diabetic is posture orthostatic tachycardia. So whenever you stand up, the heart supplies more blood than that is required. So there is a sudden increase in the blood pressure. So again, there are two conditions. One, hypotension, that is body is not supplying. So it's lethargic, it's lazy, it is not supplying blood. It doesn't care, it doesn't supply blood. Again, that happens during depression. That again happens in autonomic impairment, autonomic neuropathy like diabetic. So many of the long-term diabetic patient, if you ask them when they get up from sitting, they'll have a momentary blankness in their head, 2 to 3 seconds of blankness in their head. And whenever you talk to any patient who is extremely angry, who is extremely anxious, who has the outburst, mostly if you ask the patient to just lie down or sleep down, the anxiousness will come down, because for those patients, it's a posture orthostatic tachycardia. That is when they're standing up, the body is hyperactive. So you cannot fight with anybody just by sitting. If you have observed even yourself, if you want to really quarrel and shout at anybody, if you stand up, you would be in full blown mode. You can fight with somebody. You can you can really take on somebody when you are standing up mode. And some people just do not have any control over their anger and response when they stand up. That is because of posture orthostatic tachycardia. So posture orthostatic tachycardia and orthostatic hypotension again are the two conditions which affects body. Hypotension can be by birth also, can be due to other reasons also. Tachycardia also due to other reasons, including anger, anxiety. Now, one of the underneath principle that we have to understand is that baroreceptor is connected with our hypothalamus pituitary adrenaline axis. So we have one of the major decision axis as HP axis. So hypothalamus is the brain part. I'm too poor with the spelling, so I try to avoid writing anything whenever I can. And then we have this pituitary gland, the hormonal gland, with which the baroreceptors is connected. And then we have this, adrenaline glands, which also, produces cortisol when required. So we have this adrenaline gland. So this is the pituitary axis, hypothalamus pituitary adrenaline axis. And this is connected with the baroreceptor that measures the orthostatic homeostasis between the top portion of the heart to the bottom portion of the heart. So this is the baroreceptor. Therefore, whenever some patient has got a stroke or cerebral stroke or has got a chest pain, we generally ask them not to take a pillow, in the head and increase the not to increase the distance between head and the heart. So we remove the pillow. However, we ask them to just elevate their legs. So what happens is the blood aram se that comes down in the return path, that comes down and completes the head circle. So one of the easiest way to prevent a cerebral stroke is, if you know somebody is a hypertensive patient, the hypertensive patient should not increase the uh, uh, distance from head to heart. So the pillow should be removed, and if you can keep the pillow below your legs, then the slanting ensures that the blood always goes to the head. So anybody who is having the orthostatic hypotension, maybe due to hypertension or anything, hypertensive patient who are very prone to stroke, we ask them to tilt their legs and keep their head without pillow. That is one of the ways you can prevent cerebral strokes. Coming back to this, so when the baroreceptor is not working properly, or when there is the orthostatic imbalance in the body, again this orthostatic imbalance can be due to, so as I've said, there are two conditions: orthostatic hypotension, and the other condition, and the other clinical condition is posture orthostatic tachycardia, where the moment you stand up, your heart rate increases over 100. So these are the two extreme conditions again, in the which hampers the orthostatic homeostasis. One is POTS and one is OH. One is POTS and one is OH. Then again, the reason of orthostatic hypotension and posture orthostatic tachycardia is often hormonal. And whenever the body has to produce the orthostatic homeostasis, it is always performed through our hormone, and T3 T4 TSH plays T3 T4 TSH plays a major role in this, right? So we have this orthostatic homeostasis which gets impaired by these two condition. Now, what is the ideal condition? As you stand up from sleeping, there is a low pressure in the brain, heart rate should increase. So the moment you stand up, there is a low pressure in the brain, so your heart rate gets increased. Then once the pressure of the higher part of the brain and the lower part of the brain gets stabilized, the heart rate gets stabilized, and then the heart rate falls down because the normal cycle blood circulation reduces, so you don't have to pump the blood. So the heart rate comes down, but it is always little higher than the normal, and then you have this. So you always see a square pulse pattern in the orthostatic page in case the patient's orthostatic system is working fine. So if we look into any data, let's say in this case, you see the this is basically a tachycardic patient anyway, so resting heart rate was about 120, but as he stood up, his heart rate increased. Then it decrease. So the orthostatic system is working fine. But there are other abnormalities in the body because of which it is not coming to balance. It is coming down, then again it is going high. So this patient has got a severe orthostatic condition. Again, if we look into this specific report, the normal sitting heart rate was 105, and when the patient stood up, instead of the heart rate going high, heart rate is coming low. So this is again the orthostatic impairment. Now, these are the two interesting cases. In the orthostatic, if the square pulse doesn't appear at the top, if you don't see a square pulse at the top, you know that there is an orthostatic impairment. Now, in this case, the heart rate, instead of coming high, heart rate is coming down. This could be due to low pressure. This is an ideal case of orthostatic hypotension. An orthostatic hypotension is one where after you stand up, your sympathetic system doesn't activate, your heart rate flows, and there is always an effect in the brain. Posture orthostatic tachycardia, on the other hand, is the exact opposite reason, where you stand up, your heart rate increases. And in some cases, in some hypertensive cases who are pathologically hypertensive, you will see the pattern something like this. So their heart rate is never going to come down. And during the entire orthostatic test, you will see that their heart rate is increasing and increasing. If you see any patient's heart rate increasing in this fashion, in the orthostatic, if you see a staircase that is going higher and higher, this is a hypertensive case. This is a pure hypertensive case, irrespective of whatever his BP is. It's a pure hypertensive case. The orthostatic homeostasis has not been restored. Now, how do you know that this is a hypertensive case? As I discussed yesterday or last class, that whenever our heart pumps the blood, due to the principle of the physics, if our body is stationary and the blood is pumped, so when the blood comes to the face, our face goes forward. And then as the blood goes back, again it goes back. So our face is always in the motion like this, due to the blood circulation. But our nervous system balances this. So we don't feel like we are always moving in this fashion. However, whenever there is a hypertension, the nervous system doesn't have enough ability to use the motors to compensate for the motion. So there is always this increasing motion. And that is same with the finger capillary. So when you hold the mobile, it's going to be moving in this way, ever so slightly. There will be a micro tremor. So in the case of hypertensive patient, what you'll see is the tremor over here. You can see this in this case. This black color one is the tremor signal. So the nervous system is trying to compensate for the movement forward, but it is unable to. So you will see a very, 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 very uniform pattern of the movement. Whenever you see this pattern of the movement, there are two reasons for which this movement happens. Number A, nervous system is totally not working. Number B, there is a hypertension. So any patient with spinal cord injury, you'll see this tremor. Any patient with Parkinson's disease, you'll see this tremor, because this tremor is going to be extremely high. This tremor is going to be extremely high because they don't have a nervous system, they don't have a fixed nervous system. But on the other hand, for the hypertensive patient, it will be little higher. So if you observe anybody who is raging, any angry person, you'll be able to minutely observe this pattern where his entire body will be shaking. This shaking is because the nervous system is then in the high anger. The hypertension is so high that the nervous system is unable to stabilize the body. So his body gets shaken because there is a hypertension underneath hypertension, and the nervous system is unable to balance that. This signal over here in the Lyfas page, a signal quality analysis, this black color signal is a representation of how much underneath movement you have. For really pathologically destroyed nervous system patients, somebody like spinal cord injury, or somebody like neuropathy, complete neuropathy, you will see this as a much more higher tremor. The tremor will be much more higher, and for other patients this tremor is lower. So more or less from this tremor, you can understand whether the patient is hypertensive or not. So BP is not something based on which we call somebody is hypertensive or not. High BP, yes, high BP, but hypertensive has got nothing to do with BP, because BP you are measuring only the arterial BP in the cuff. Hypertension can be caused in different areas. I mean, we can have renal hypertension, we can have portal vein hypertension, we can have hypertension due to anxiety, we can have hypertension due to overstress, and so on and so forth. So hypertension can not always be identified from the blood pressure value. Yes, it is a good measure of hypertension, but whenever we see this pattern, we know that there is an hypertension that is going on in the body. So we try to figure out, is there any other path other than the arteries where there could be an hypertension. We try to figure out anxiety, we try to figure out renal hypertension, portal vein hypertension, we try to figure out whether there is a hypertension due to vasodilation, and so on and so forth. So this is a page that will tell you whether the patient has got an underneath hypertension condition or not. And this orthostatic page is going to tell us whether the patient's orthostatic homeostasis is there or not. Orthostatic homeostasis is again related to the endocrine system. The homeostasis is brought, orthostatic homeostasis is brought by the endocrine system. So by looking at the orthostatic page, we can know whether the patient's endocrine system is working or not. And one of the most important marker is this marker over here. Ortho-Cario score, reference cardio balance. Now, I'm going to explain you this in a bit detail so that you know what is going on. Now, what is this? See, I explained you the arterial wave in the previous video, where we have point A, point B, point C, point D in the arterial signal. So just like ECG, we measure A by B, B by C, D by B as the three parameters. So based on that, there are four components in that arterial page. Based on that, we calculate a cardiac score whose value is between 0 to 100. So cardiac score close to 100 is the most ideal, but any score is fine, because human body will have different kind of physio and pathological compensation for time to time with the arterial network. So reference cardio score at rest is 56. That means when you were taking the signal during the rest period, so first 15 seconds you are at rest. When you are at rest, the cardiac signal, its score was 56. When you stood up, the score was 68. So what we do is we take a difference between these two. Let's say in this case, the difference is 12. And this difference should be always less than the 8. So anybody who has got a very brilliant endocrine system, all the hormones are balanced, you will see that all the hormones are balanced. You'll see that the score at rest and score when he stood up is almost similar. When it is between 8 to 20, we say that subclinical. When the score is 8 to 20, we say that there is a subclinical hormonal issue. It could be subclinical high TSH. It could be a subclinical problem of T3 to T4 conversion, and so and so. So during the normal time, the hormone system is working fine, but just at the moment when you are standing up, there is a hormonal imbalance which is not able to manage that. So we call this a subclinical hormonal problem. That could be T3, T4, that could be cortisol, adrenaline, or estrogen, testosterone, any of this balance. But whenever this difference, the difference between the sitting signals cardiac score and standing signals cardiac score, if it goes more than 20, then we know that if it is more than 20, then we know that there is a clinical hormonal imbalance, irrespective of what is the TSH value. So in terms of psychophysiology, we don't put a lot of emphasis onto resting, venous blood and what is the TSH value. If it is more than 20, and in couple of tests that has been reappearing, so we know that there is a problem with the hormonal system, and the hormonal system is not going to work very good under the stress. So when this patient goes angry, or when this patient goes high, requires more blood, thinking a lot, then at that time there will be a hormonal imbalance. It will cause an orthostatic hypotension or orthostatic tachycardia, and the patient will have a problem with the brain. So any patient, you see this pattern where resting orthocardio score, that is the arterial signal score while he is rest, and then the arterial signal score when he has stood up. If the difference between these two is more than 20, then there is an endocrine system problem. As such, the body is not capable enough of achieving orthostatic homeostasis very easily. As such, all these patients, one of the common thing that you may notice is will have a issue with irritation, anger, or something like that, and there are very high possibility that they have that minute 1 to 2 seconds of blackout when they stand up from sitting. So endocrine system problem, we know from this. So orthostatic page, if we look, we have an endocrine system problem. And this can also be seen from this graph. If during the orthostatic, you'll see many patterns which will have a flat line. So you'll be seeing some pattern where you'll be able to see kind of a flat line at certain stage of the orthostatic. So let's say that you have this repeated signal, and while the patient was standing up, you will see something like this, where there is no, exactly when he is standing up, almost flat area, and then it will increase. So if you ever see an area like this in the orthostatic, which is kind of a flat, then you have to know that this patient definitely has got TSH problem, thyroid problem. So in the orthostatic page, when the patient is standing up and he doesn't get a signal, the body doesn't get enough amplitude, the pulse doesn't have enough weight for a period of time, this is obviously always a condition with TSH. So the patient is either having TSH or will, thyroid problem, or will go for hypothyroidism. So this is a specific condition of hypothyroidism. You see a flattishness line in the orthostatic, you know that this patient may have a hypothyroidism, either a history of it, or is undergoing a hypothyroidism, or will have a hypothyroidism. So this is all that the meaning of the orthostatic. So we are looking for the square pulse in the orthostatic signal. If square pulse is there, everything is fine. If the graph is increasing, there is a hypertension. If there is a flat line, then there is a endocrine problem with the orthostatic. So we are pretty much done with orthostatic part also. I'd appreciate if you have any question. I would like to take up the questions.
No, sir, it is very much clear actually. Sir, but one thing, you said baroreceptors are connected with the hypothalamus pituitary adrenal axis.
Yeah.
So just can you tell me how they are connected actually?
So as you may be knowing, my knowledge in biology is as good as my knowledge in rocket science. I'm very poor in biology, so I can explain you about the system, and I'll share with you the structure, but I'm not really biologically very enlightened to be able to answer you that. I'll share with
Okay.
you the papers. You can probably be in a better position to explain me what is that anatomical structure is.
Okay, sir. Because we explain in detail for to the students actually baroreceptors and
Yeah.
hypothalamus adrenal axis separately actually. So this
Huh.
concept is little new for me actually. Like
Yeah.
baroreceptor
So
connected with
when what happens is, because in our MBBS courses we don't really go deep into the heart rate variability. Even in MD physiology, many physiologists, they read heart rate variability, but because the heart rate variability is in depth usage in our diagnosis system hasn't been that well established so far. It is only recently, when US has started adopting heart rate variability, have we started adopting the heart rate variability. So because baroreceptor is the sensor, and autonomic system has to respond to the change in the blood pressure, and HP axis will be the one who is responsible for making sure that the top and the lower blood pressure is same. They'll be connected with the autonomic system. So therefore, orthostatic hypotension is always also said that orthostatic hypotension is a result of autonomic impairment or autonomic neuropathy. But how anatomically they are connected, I have to see.
Okay, sir. Okay. Okay. Thank you, sir.
Thank you. So let's connect back for the last session. I
Okay.
hope